So hi everyone, welcome to our Advocacy and Wellness webinar for our chapters. My name is Angie Day and I'm the Chapter and Volunteer Services Director at DBSA. Our speaker, Phyllis Foxworth, will start her presentation momentarily, but first I wanted to share some logistical information. First, we'll be recording this webinar. It will be available in Chapter Management at a later date. And then next, at the end of our webinar, Phyllis will respond to your questions that you can submit at any time. Click the dialog box in the lower left-hand corner of your screen. In that dialog box, you can add your question, and I will moderate those at the end of Phyllis's presentation. So welcome, Phyllis.
Thank you, Angie. Welcome to the Advocacy and Wellness webinar. My name is Phyllis Foxworth, and I am the Advocacy Vice President for DBSA. As such, I am responsible for directing all of the organization's national advocacy efforts, as well as developing and supporting DBSA's statewide grassroots organizations. I am also a founding member of the DBSA Chicago Loop chapter and facilitate a weekly meeting. The focus of DBSA advocacy mirrors the organizational goals to facilitate wellness for individuals living with mood disorders by providing support, education, and research opportunities to DBSA participants. Beginning with support, the network of 250 chapter affiliates serve over 57,000 people through 650 support group meetings. Additionally, DBSA offers leading-edge, interactive online resources to inform, empower, support, and inspire individuals to achieve the lives they want to lead. DBSA provides up-to-date, scientifically based tools and information presented in easily understandable language that empowers individuals to make informed decisions and be the creators and drivers of their own treatment plans. DBSA also participates in research as we seek treatment solutions that target the whole health of the individual. We have currently or are currently working on 3 different PCORI grants and empower DBSA participants to find appropriate research opportunities for themselves. We also develop advocacy campaigns designed to increase access to quality care through system change in the delivery of healthcare services and ending stigma associated with mental health conditions that can often be one of the biggest barriers to receiving care. Today's webinar will inform on the DBSA advocacy programs we've created to achieve those advocacy goals and share information on how you too can participate. So why should we advocate? For many people, being empowered is an important tool in their wellness plan. This is often the case with people who are newly diagnosed. After being silenced for so long, they are looking for a constructive way to make their voice heard. And just as important for many people who may have experienced a difficult journey on their way to wellness, they want to make sure that others have an opportunity to find a softer landing or journey on their own way to wellness. Recognizing that stigma and public health policies might be barriers, these people want to make systemic and institutional changes to the way society views and treats mental health conditions. There are several ways organizations can bring about systemic change. Both can be equally effective if executed properly. The first is to buy mind share. Think about the change in Americans' attitude around smoking. There was a time when 45% of Americans smoked. Today, that number stands at 15%. A major contributor to this change in attitudes is the advertising about the health risks of cigarettes and education campaigns that started with a new generation of potential smokers. These programs were indirectly funded by the tobacco industry as a result of lawsuit settlements. Another effective way to affect change is through coordinated mobilization. America has a proud legacy of systemic change through mobilization. The women's suffragette, organized labor, and civil rights movements of the last century brought about long-standing change in attitudes about the rights of women, workers, and minorities in this country. This idea of bringing about change through organizing is alive and strong in this century as well. There are many different types of advocacy. I bet most of you on this call have in one way or another engaged in self-advocacy. When you believe that you have personally been wronged, whether that is something as simple as being charged incorrectly for a meal, or something much more serious as not getting timely and affordable access to health care, you have probably brought it to the attention of someone who can change that situation. That could be the wait staff or manager of the restaurant, or a doctor's office, or a customer service rep for an insurance plan. This is often referred to as self-advocacy. But there are other forms of advocacy that seek to right a wrong on a larger scale. Community advocates are like-minded people who share a common concern about a topic and are willing to act upon it. Their engagement is typically limited. Grassroots advocacy is when a group of people who have a shared and common experience on a topic work together as a team to mobilize. A major action around grassroots advocacy is to coordinate activities at the same time as a group, to educate public policy decision makers on an issue that the group cares about. It is important to note that a guiding principle of community and grassroots advocacy is volunteerism. Participants are not paid. For the purpose of this webinar, we will focus on community and grassroots advocacy. So we don't have access to the money required to quickly and effectively change attitudes around mental health, unlike the example I presented earlier around cessation of smoking advocacy. But we do have something else just as effective: people, and lots of them. If you recall the first slide you saw in this webinar, I reported that DBSA chapters serve 57,000 people a year. If we were able to mobilize just a fraction of those people to participate in the advocacy along with their family and friends, we suddenly become a movement, a very powerful movement. DBSA makes it easy for people to join a community through our advocacy platform. This is an effective way for those who want to tip their toes into advocacy without making a huge commitment. But the potential to make real change in your communities is great. By subscribing to the DBSA advocacy platform, you will receive emails from DBSA advising you when it is most advantageous to reach out to your elected officials, asking them to oppose or support key legislation. For example, DBSA has been sending out action alerts to subscribers, asking them to contact their congressional representatives and senators, asking them to vote no on legislation that would repeal the Affordable Care Act since early this spring. Today we have 2,100 subscribers to the DBSA advocacy platform, and we receive excellent results from our action alerts. Typically, over 25% open the emails and another 7% take action. Imagine the power the DBSA community would wield if we had 21,000 subscribers and 7% were responding to an action alert. Your elected officials would stand up and take notice that DBSA was an organization to be reckoned with. It's easy to register. Just go to the dbsaalliance.org, take action, and select the subscribe button. You must, however, opt in for emails in order to continue to get communications from us. Then ask all your chapter participants to do the same thing. I have sheets that I made up and keep with our chapter meeting supply box. Every time a new person comes, I give them the opportunity to fill out an advocacy platform registration sheet. I then go home and register them on the platform after the meeting. This is something meaningful and easy that all of you can do right now starting today. So let's move on to the DBSA Grassroots program. The DBSA Grassroots Advocacy Program seeks to form statewide organizations, often called a GO. The GO is not part of the chapters program, but is a separate and distinct program offered by DBSA. It is open to anyone within the DBSA community, regardless of whether or not they attend a support group meeting. Examples of GO participants include people who attend support groups, participants in the Balanced Mind Parents Network, the DBSA Advocacy Platform subscribers, Care for Your Mind readers, DBSA Facebook fans, and peer specialists. As mentioned earlier, the DBSA advocacy programs mirror the organization's core objectives to create a world that targets the whole health of the individual, not just the mitigation of this week's, this month's, or this year's mood disorder episode. We've identified 3 key areas where we can both make the biggest impact in creating that world where people can attain self-identified whole health goals, and just as important, empower DBSA participants to be partners in creating that world. The guiding principles around our advocacy is to increase access to quality mental health care that uses evidence-based treatment models and eliminates barriers that can keep people from leading the lives they want. One way to do that is to ensure implementation of mental health parity laws. A federal law that says your insurance plan must offer the same level of benefits for mental health conditions as it does for physical health conditions. Another prong in our advocacy is promoting peer support as an evidence-based model of care and creating an environment for the development of the peer support specialist workforce. A third objective is to end discrimination towards people living with mental health conditions in their schools, places of employment, and social communities. To assist advocates in becoming involved, we have created a structure for a statewide GO. The statewide GOs are implemented and executed by volunteers with support from the national organization. A GO is made up of 3 committees: the Peer-Led Legislative Advocacy Committee, the Communications Committee, and the Community Outreach and Education Committee. I'll be reviewing each of the programs within each of these committees over the next few minutes. The Peer-Led Legislative Advocacy Committee works with DBSA National to identify state legislative issues that fall within the core objectives of DBSA. For example, Many states are currently working on passing laws to strengthen the federal mental health parity law at the state level. Others, like Illinois, are working on comprehensive mental health reform legislation. Regardless, with the support of the national organization, this committee can deliver a legislative storytelling workshop. At this workshop, attendees learn about legislation in their state, and then we help them identify personal experiences that relate to that legislation. Participants are then taught how to schedule a meeting with their state legislators and both educate them on the legislation and how this legislation directly affects them or a family member. This committee also has access to DBSA resources to mobilize people in their state. They can collect contacts and register them in the DBSA advocacy platform, and then send those contacts emails at the most appropriate times, asking them to contact their state legislators, and further, asking the legislators to support or oppose legislation. Other states have used the contacts in the database to inform advocates about upcoming events, such as a state mental health rally at their state capital. In addition, state goes can have their own state page on the DBSA advocacy platform. On this page, advocates can educate viewers about pending legislation or regulatory policies in their state. I encourage all of you to go to the DBSA advocacy platform and review the state pages that are posted there. The Communication Committee straddles both the Legislative Committee and the Community Outreach and Education Committee. Their focus is on publishing the monthly newsletter, Making Mental Health Matter. This newsletter is distributed the first Wednesday of every month. The newsletter has 4 regular columns, and all the columns are written by the Go advocates. The first column, titled Speaking Up, highlights the work of an advocate and serves as inspiration to others. The second column, In the Know, provides information on mental health policy or legislation. The third column, People Power, provides advocacy tips. And finally, last but not least, the fourth column, Victory Corner, showcases a recent legislative or regulatory win in one of the Go states. Advocates on this committee can also assist their peers on the Legislative Committee to write copy for their state advocacy pages and keep it updated. As I mentioned earlier, one of the biggest barriers to accessing quality mental health care is the lack of positive discussions around mental health. The I'm Here program hopes to change those attitudes by providing an opportunity for people to learn a little bit about mental health in a positive way, and to provide a tool for people to have a discussion. Examples of places where this program has been given are faith-based organizations, universities, and professional groups. During this 45-minute program, the workshop attendees are shown a video describing the I'm Here program and a short PowerPoint presentation on the prevalence of mental health. Then each participant pairs up with someone else and they are asked to open the I'm Here kits. These kits contain a safety pin and lime green beads. Working in pairs, the participants make a lime green safety pin and have a discussion about how they are here and can be a support to the other person in their wellness journey. Each participant is given a packet to take home so that they can have a conversation with a friend or family member. It is our hope that we can change the conversation around mental health one conversation at a time and break down some of those barriers that keep people from accessing mental health care. People who serve on this committee identify groups they want to give the presentation to and arrange the logistics of the workshop. DBSA National supports the program by providing training and supplying the kits. Another barrier to care is lack of information on how to maximize your health insurance benefits. Advocates who work on this program deliver a workshop that educates people about mental health parity laws. These laws state that insurance plans must provide the same level of coverage for mental health benefits as it does for physical health. This committee also works with other advocacy organizations in their states that are focusing on regulatory and judicial remedies when people are unable to access care using their health insurance plans. Similar to the I'm Here program, DBSA provides training on how to deliver the presentation and certifies that a person is qualified to deliver the DBSA How to Maximize Your Health Insurance workshop. In summary, while advocacy may not be a passion for everyone, for many people, being empowered to have a voice about public policy that directly affects the quality of and access to mental health care, or to educate people in a positive way around mental health, is an important part of their wellness program. The goal of the DBSA advocacy program is to have programs available for those people who do want to get involved. People who have participated in the DBSA advocacy program have shared that it has enriched their lives and that they did it because it was an important aspect of their wellness plan. It is our intention to create a wide enough variety of programs so that there is something for everyone. At a minimum, everyone can register at the DBSA advocacy platform. This will enable you to receive the monthly newsletter, Making Mental Health Matter, and receive emails from DBSA advising you on when it is most advantageous for us collectively as a community to contact our legislators. Should you wish to become more involved in the program outlined this afternoon, please contact me, and together we can create a pathway forward to help you participate in the ways that are most meaningful to you. Thank you.
Phyllis, thank you so much for your presentation. Now we'll open up to questions. If you haven't already, to all of our participants, please submit any questions that you may have for Phyllis in the dialog box in the lower left-hand corner of your screen. So I'll give everyone just a moment or two to type in those questions. Okay, the first question that we have, Phyllis, is how someone can do an I'm Here presentation in their community.
So if you're interested in learning how to do an I'm Here presentation, we have a committee of people in several different states who meet once a month to discuss the program, how it's working, and coaching each other on tips on how to roll it out in their communities. We will also then, for those who are interested, periodically provide training. We have training materials. We can do that through a conference call and webinars. So if you're interested in joining the I'm Here program, just feel free to send me an email.
Excellent. Thank you. The next question was to clarify where GOs are located and if there's not one in their state, can they start one?
Sure. Currently, we have GOs in New Jersey, Illinois, Texas, Florida, and California. The structure that we've created makes it easy for you to start a GO based on what your interest is. So if your interest is legislative, advocacy, communication, or the community outreach programs, there's a specific program tailored for you. What I would advise you to do if you're interested in starting a GO in your state, again, is just to contact me and we can talk further about what your interests are and how we can plug you in.
Great. Thank you so much, Phyllis. So that looks like that's the end of our questions. I really appreciate this presentation and hope that our audience found it helpful as well. To our participants, thank you so much for attending the webinar. As always, if you have any questions or concerns, please reach out to chapters@dbsalliance.org. Thanks again.